4 years ago, the world promised it would never forget. We clapped for healthcare workers, we shared survival stories, we said we're all in this together. But together doesn't last, or it didn't. Because the news cycle moved on, the emergency declarations expired, and millions of people got left behind. Because of the virus and because of the vaccines, too. Long COVID has stolen careers, memories, and the ability to shower without crashing. Vaccine complications have paralyzed bodies, destroyed immune systems, and trapped people in a bureaucratic nightmare. The science on both sides is real. The stories are devastating, and the system has no idea what to do with any of them. Here's what I'm not saying. I'm not saying don't get vaccinated. Vaccines have saved most of our lives from the likes of measles, smallpox, and tuberculosis. 100 years ago, you might have a class of sixth graders where only half of them actually lived to see high school. Here's what I am saying. These vaccines were rushed to make a profit, and this virus, where many of us are skeptical of its origins, has ruined countless people's lives. This isn't about being pro-vaccine or anti-vax. That binary is a trap. It's about the long COVID patients who can't remember their own keys and the vaccine injured who lose function of their organs. Damn, I wish I had like a cool send-off from here. Like, not this time, bro. In March 2026, there was a global study of over 3,000 people across 4 continents. The most common long COVID symptoms weren't cough or fever, they were neurological, brain fog, myalgia, that's muscle pain that feels like you ran a marathon you never signed up for, dizziness, headaches, sensory disturbances, the kind where lights are too bright, sounds are too loud, or your own skin feels wrong. Then there's the PNAS mouse study. Respiratory infections alone triggered loss of dopaminergic neurons. That's the Parkinson's pathway. The virus never entered the brain. The culprit was sustained inflammation. Your own immune system eating away at the cells that help you move. And the IJMS review lays it out. Persistent neuroinflammation, blood-brain barrier disruption, microthrombosis, which is tiny clots starving parts of your brain, and transcriptomic overlap with Alzheimer's. In other words, long COVID makes your brain look on a molecular level like it's aging decades and months. The clinical takeaway is an early combination of antivirals plus corticosteroids can reverse it. But if you miss that window, the damage may be permanent. Now, meet the people inside those studies. Whitney Gibb was a medical device trainer. She knew how to explain complex technology to surgeons. Then she lost her keys in a parking garage for 2 hours. Couldn't remember the name of a company she just met with. She spent $20,000 on treatments out of pocket because insurance doesn't cover, we don't know what this is. She lost a job she loved because she couldn't remember what she was working on. Then there's Samantha Crosman. Samantha Crosman is 28 years old, lives with her parents in Massachusetts, rarely leaves her bedroom. Any extra exertion, a conversation, a shower, or walking to the mailbox, triggers a crash that immobilizes her for days. Her planned move to New York for an entertainment career is a distant memory. She's just too sick. Gabby Rudge Cox in the UK was diagnosed with fibromyalgia, ME/CFS, and POTS on top of long COVID. She says having a shower can be the big part of your day, not the highlight, the entire day's allocation of energy. Treva Taylor is 56 from Brooklyn, former hospital administrator, spent 6 weeks in ICU. She was scheduled to get vaccinated the day after she got sick. Now she carries oxygen everywhere. She testifies before Social Security to help others navigate a system that seems designed to say no. Susan is 69 in the UK, took 2.5 years to recover, credits pacing, planning, and prioritizing. Says the experience irrevocably changed her as a person, more patient, more considerate, which is beautiful. It's also a hell of a price to pay for a personality upgrade. These are people who used to have careers, plans, and the ability to remember their own car keys, and they're still waiting for the world to catch on to what's happened to them. Now, let's talk about the other side of the needle, because if we're going to hold the system accountable for long COVID, we have to hold it accountable here too. Let's talk about the recognized risks of the vaccine. Myocarditis and pericarditis, inflammation of the heart muscle or its lining. Pfizer's own label acknowledges increased risk, highest in males aged 12 to 24, about 27 cases per million doses. The FDA added warning labels. That's not a secret, that's a fact, it's right there. Guillain-Barré syndrome, an autoimmune attack on peripheral nerves linked to AstraZeneca and Johnson & Johnson, about 1 in 100,000 doses. It can leave you paralyzed on a ventilator or recovering for years. Capillary leak syndrome, also associated with AstraZeneca. Your blood vessels become strainers, fluids leak into your tissues. It's rare, but it's devastating. VAERS, the Vaccine Adverse Event Reporting System, has logged over 340,000 reports, 22,000 serious, about 4,500 deaths. The CDC says no unusual patterns in cause of death. That's their official line. We'll come back to that. Then there's the FDA internal memo. Peter Marks, the director of the Center for Biologics Evaluation and Research, said at least 10 children have died because of COVID shots. He called that number certainly an underestimate. He cited vaccine-induced myocarditis. That's the FDA's own top official in an internal document. The agency that authorized these vaccines admitted internally that children have died from them. That admission never made it to the nightly news. Sandra Byron is in Australia. She got the AstraZeneca vaccine. It triggered Guillain-Barré and capillary leak syndrome. Her hands are now rated as functionally useless. She can't be touched, even a hug causes pain. Can't shower without assistance, can't eat a normal meal. But here's the thing Sandra says is worse than the paralysis. The compensation scheme. Over 4 years of paperwork, requests for one more document, delays for years, not months. She calls it absolute torture. And she's not exaggerating. The physical damage is permanent. The bureaucratic damage might be worse. Tonja Johnson was an American woman who got the Johnson & Johnson vaccine.
Hello, my name is Tonja Johnson, and I've lived in Nevada for the past 18 years. They put out a memorandum that said that if you did not get the COVID vaccine, you'd be fired. So I waited until the last minute when I got the COVID vaccine, and I've had nothing but absolute horrific trouble. I have a hard time remembering words that I want to say, but that all happened the day after I got the COVID vaccine, which was the Johnson & Johnson 1 shot. They had to go in and do surgery on me 4 times. I died on the table all 4 times. They brought me back. They took out my stomach. They took out my spleen. They fixed my esophagus.
Within 24 hours, dizzy spells, chest pain, stomach agony. Within months, she weighed 70 pounds and was in a wheelchair. She died in her husband's arms in October 2023. Cause of death, lung failure, but cause of lung failure listed as unknown. Her husband's words, I think if she wouldn't have gotten the shot, she would still be here. Legaspi is 72 years old in New York City. She got the Moderna vaccine. The morning after, blood came gushing from her mouth, her nose, her tongue. She survived after 2 weeks in a hospital. She called this her second life, and she says she has no regrets about getting vaccinated. That's the complexity right there. A woman who almost died from the vaccine and still believes in it because she also knows what COVID could have done, which is worse. I don't know. You tell me. It's a lose-lose situation either way. These are the stories the headlines skip because they're uncomfortable. Rare doesn't mean that it doesn't exist. And one person's acceptable risk is another person's life sentence. Here's where it gets genuinely infuriating, because whether you were hurt by the virus or the vaccine, the aftermath is almost identical. Disbelief, red tape, and no safety net. On the long COVID side, there is no diagnostic test, no biomarker. In 2026, you cannot draw blood and say, yes, this person has long COVID. Doctors still rely on patient self-reports, which means if you look fine, you kind of probably are, according to them. Social Security disability claims often fail due to gaps in medical documentation. Gaps that exist because no test exists. So you're disabled, but you can't prove it, and you can't afford a specialist who might believe you. And the stigma is in your head, just push through, which is exactly the opposite of what pacing requires. You wouldn't tell someone with a broken leg to just walk it off, but tell someone whose brain is inflamed to try harder. That's fine, right? No. On the vaccine side, the U.S. Countermeasures Injury Compensation Program covers only vaccines recommended by the CDC. Many COVID vaccine injury claims are excluded or stuck in limbo. The program is so underfunded and understaffed that even obvious cases take years, and there is no public acknowledgement of the FDA's own internal admission that children have died from vaccine-induced myocarditis. No recall, just silence on the issue. Long COVID patients are told they're making it up. Vaccine-injured patients are told they're making it up. Both are told to be grateful that they're alive, as if gratitude is a treatment plan or something. Both are drowning in paperwork, and neither group has a clear path to help. The system didn't fail one side, it failed both, just in slightly different ways. Don't lose your mind, okay? Because I'm about to say 2 things that sound contradictory but are both true. For a moment, let's forget that Bill Gates was in a room with a bunch of powerful people, basically drawing up the plan for a pandemic to reduce population, among other things. That's for another video. Let's stick to a few core facts right now, okay? Fact 1. COVID vaccines saved millions of lives. The World Health Organization estimates 14 to 19 million deaths prevented in the first year alone. But apparently the WHO was in cahoots with China covering up the virus for months before it hit its breaking point anyway. Anyway, look, fact 2, rare serious adverse events happened because of the vaccine. People died, people were paralyzed, people lost the use of their hands, and FDA's own director acknowledged child deaths from the shots. Both things can be true. The vaccines were a medical miracle for some, a financial heist for pharmaceuticals, and a tragedy for a small number of people. Long COVID is a public health catastrophe and has been largely abandoned. The problem is we built a culture where holding both truths feels like treason. If you talk about vaccine injuries, you're anti-vax. If you talk about long COVID, you're fear-mongering. That's not intellectual honesty. That's textbook tribalism, groupthink. Like, damn, are we children? Shit. We act like it, god damn it. So we've got people suffering, a system that's abandoned them, and a public conversation that can't hold complexity. What do we actually do? For long COVID, look, fund biomarker research. A simple blood test will end the is it real debate overnight. It's not complicated. Create dedicated clinics. The UK has over 100 long COVID clinics. The US has a patchwork of underfunded, overbooked specialists. If you live in rural America, you're basically on your own. Update disability systems. Pacing isn't laziness, it's survival, it's fucking rehab, okay? Train adjudicators to understand that a good day doesn't mean you're faking the bad ones. For vaccine injuries, fix the compensation schemes. 4 years is not timely. Australia, the US, every country with a program, they all need a hard look in the mirror. Acknowledge the rare harms publicly. Okay? 4 years ago, we promised we'd never forget, and we forgot anyway. The news moved on, the emergency orders expired, the funding dried up. The politicians stopped wearing masks on TV. But Whitney still can't find her keys. Sandra still can't use her hands. Samantha still lives in her parents' basement. Tonja is still dead, and her husband still wonders if the shot that was supposed to save her actually killed her instead. This video is about seeing the people the system left behind on both sides of the needle. They're not asking for much, just to be believed, just to be helped, just to be counted. Just a doctor who doesn't roll their eyes, just a disability form that doesn't assume you're lying. Just someone in power to say, we see you and we're sorry and we're going to try. Maybe it's time when we started counting. Maybe it's time when we started recognizing. Maybe it's time when we started helping. Because, come on, these institutions, they're all about the product. They don't give a fuck about the people. This has been the Adonis Black Show. Stay sharp, stay vigilant, and if you're one of the forgotten, I see you. And I got your back, all right? I'll see you next video. Peace.